Greetings, everyone. I'm in day 5 of a mandatory precautionary self-quarantine or self-isolation requirement that was introduced by the government on March 16th of this year, approximately 10 days ago. And uh, yesterday, a family member had a major tantrum and left the house in a huff because she was told that I stepped out of my room into the hallway of the house. And she must have encryptically contacted other family members because shortly after I got lengthy texts, full screen long texts from a son who lives in a different town, and he says that I should be in a hotel, I should not be staying at home, and by staying at home I am risking the life of other family members. So I realized at that point that there's a serious misperception, misinformation probably being circulated out there, and I just wanted to do a quick review of current health advisories and guidelines, and this is going to be evidence-based. I'm going to show you each document and show you its origin and so forth, and we're going to make sure together it's from a reliable source and also it is current. The first document I want to share with you is the actual document that was handed to me by a border and customs officer as I returned to the country, and describes basically what I'm required to do, and it is advising that I should stay at home, keep a distance from others, monitor my symptoms, do not accept any new visitors. I did say that I'll verify it first. Here's the issuer of this document. Like I said, it was handed to me by an officer, so it's fairly official. Okay. So recommending or requiring you to actually stay at home, keep a distance from others, no visitors, monitor your symptoms, and use proper hygiene. And then down here somewhere, if I may show you, it says that if you develop symptoms, then you should isolate yourself from other people. This is what's current. At the back, it just tells you proper hygiene you should explore, and some telephone numbers and a toll-free number here if you needed help. So this is what this document says you're supposed to do. As a matter of fact, my wife and I decided to go a step further, so I suggested that she contacts our local health nurse, which she did, and she gave us also her advice and input. I then went on and did some further research into this, and this document here, let me show you first who's issuing it. Hopefully you can see it's the actual government of Alberta, and it shows the date there at the bottom, which is February 20th, February of this year. And this document also addresses self-isolation, and here it refers to the fact that actually it's staying at home. It refers here to should you take public transit, that you should avoid that. It also says that you can use delivery or pickup services at your grocery store, etc. Okay, and so this is what the government of Alberta guideline is for self-isolation, and most of the information you'll find actually is for people who have contracted the illness and are showing symptoms, not necessarily the precautionary measures that we're taking. We're symptom-free travelers who are just as a precaution asked to stay at home and monitor our symptoms. Then I was curious about what our neighbors down south are doing. So this is from the Center of Disease Control down in the United States. This is also current. I think you can see the data when I downloaded it here. And it lists countries for travelers. These are high-risk areas. And actually, the country I was at is not listed here at all, nevertheless. So it's not regarded as a high-risk country into the US. And in a nutshell, basically, I just highlighted things at the top. Once again, it's referring to the same principle, is stay at home and practice social distancing. Okay? So this is what they're doing down south. And again, the period is about 14 days also, the recommended period, which is thought to be the incubation period for the virus. I was also curious about what they've done across the waters in the UK, and this is a pamphlet from the National Health Service, NHS, in the United Kingdom. This is the date it was downloaded. So, and here they actually talk about self-isolation when you have the symptoms. And a lot of young people don't realize that the majority of patients showing symptoms of the coronavirus are managed at home. They don't need to be hospitalized. And that's quite essential for us to understand a little bit more about this, what's going on. So sooner or later, some of us may be required to care for someone who actually has the illness. Okay, so stigmatization is dangerous. And they're talking to people who either have the symptoms or are living in close proximity with that person. Okay, it also requires staying at home, and then it does allow you to leave the house for exercise once a day. Is this upside down? No, it's not. Sorry. And as I look at the screen, it looks backwards. Sorry. And you can actually use your back garden. So basically, none of the advisories, none of the official advisories say that you should lock yourself up in a room in your house, because not everybody has the means to have a room in their house. And we're lucky here I have an ensuite room. However, I opted to do this as an extra precaution, right? But none of the advisors say that you must say unlock your door in one room in the house. None of the advisors say you can't step outside into your backyard. So, and absolutely none of them said anything about you must check yourself into a hotel. It all referred to staying at home, staying home, staying home. And interestingly enough, when I asked my son several times, where did you learn this? Where did you find out about this? Where did you read this? That you must stay at home, stay in a hotel, otherwise you're subjecting your family members to risk. And he could not answer the direct question. Then he jumped into, well, there's legislation now that's been introduced which will fine people and so forth. Great, fantastic. You still haven't answered my question. Oh, they're going to be checking with people to make sure that they're self-quarantine. Perfect. It's a great measure. Thumbs up to the authorities. Absolutely. We're on board. But you still haven't answered my question. Where did you find out that if I don't stay in a hotel, I'm subjecting my family members to risk? So it kind of, there's enough tension happening in the world. There's enough anxiety occurring in the world without us having to contribute further to it, without us becoming relays to misinformation. Please look for the source. Make sure you're getting information from a reliable source. Please get your information. Make sure your information is up to date, because we're learning more and more about this virus. And that's my recommendation to everyone. And I welcome your comments, suggestions, and questions. Thank you. Have a wonderful day. Stay safe. Stay well.